We are from day morning to night. We pass through different stages of thought, moods, disorders, isn't it? So when we first come and see into the office and see a letter with a hike in our salary, we feel elated. And when we see sometimes someone is promoted and we are not promoted, we feel depressed. So like this, there are different situations in the life, a job, family, surroundings, family, neighborhood, everywhere. There are so many situations we come across, but we all tackle these problems and we are balanced and we stay balanced and we adjust. Few hours or few days we may be unhappy, but afterwards we become happy. That is a routine thing. So we're all normal people. That's why we're able to work in ecosystem, isn't it? But we have seen some cases in our neighborhood, in our society, where there are some abnormal people and they cannot live independently, they cannot live happily, and they cannot mingle with people. They, they do the same things, routine things. There are so many instances in the life that disturb them. They may not disturb others, but they disturb themselves. And certain cases, they because of their disturbance, they disturb their family members and the society also. So there are so many things in which we are not aware of it. So today is the opportunity where I bring forward, introduce Dr. Harish Reddy, a young budding psychiatrist of Hyderabad. He has done his MD psychiatry from Karimnagar, and he has started Tranquil Minds Hospital in Kukatpalli with around 50 beds. We have few hospitals, psychiatric hospitals, thank God, but they are coming up now. So Dr. Harish is here to take us through what are the common disorders in the society which affect us, and what is the basic cause for this thought disturbance and thoughts in us. Dr. Harish, take the podium and enlighten our staff regarding the common problems like social thinking disorders.
Uh, Good afternoon, ladies and gentlemen. Uh, at the outset, I would like to thank Dr. C.N. Reddy Garu for having me over to talk a little bit about some of the common illnesses or some of the common problems that we might face in our day-to-day life, not just us, our friends, our family members, anyone around us in the society, right? The topic that we've chosen is when something goes wrong in the brain. How many of you think that would really something go wrong in the brain, do you think? Would anyone have anything to say about that? What do you think can go wrong? Hmm. It can vary. Yeah, that's good. So, okay, going further, that's where we are going actually. How it varies in different people. How some people can have good coping mechanisms, some may not have equally good coping mechanisms. Some may have different biological buildup, some may have different genetic buildup. So it varies person to person, even in the same family, right? Let's go further. All right, this is a case vignette. I just want to brief you about this one. There was this gentleman, Mr. Shinde, a 34-year-old man who was married, working in a very good position in an MNC. But since a month, he's been dull. He's avoiding work. He's not going to work. He's keeping to himself. He's avoiding spending time with his family. His appetite, everything's gone very, I mean, it's just not in place. What do you think about it? Any, like, any opinions? You think there is a problem there? That's very good. That, yeah, that could be, yes. That could be a good thing. Not necessarily. Well, fine. We'll stick to that. You're right, sir. It could be. I mean, we are just being taking any answer now. Right. We'll stop here. We'll come back to that later. Since most of you are, or every one of you is a science grad, I'm just going to brief you a bit about, how a neuron is, neurons are basically nerve cells, and this is a basic structure of a neuron. Why I'm talking about a neuron suddenly is psychiatry or psychological illnesses now are as much biological as any other medical or surgical illness. It's got a proper biological basis to it, and most of the basis lies within the brain, which contains millions of such neurons, right? This one right here is a three-dimensional picture of how such neurons actually synapse with each other. Synapse here, by synapse we mean when two neurons with these branches, the dendrites, when they connect each other, they actually exchange signals. So the signals that are exchanged are called neurotransmitters. I mean, they pass through each other. Let's take a normal day of one of you people. You wake up and you get ready to work. You suddenly, check your time. Am I late? So the thought of I need to rush, that neurotransmitter will have a role in that. The thought of actually running fast to work, that will also have a neurotransmitter at work. The fact that you'll take a step will have a neurotransmitter at work. The fact that you'll keep a foot above the other, that will have some kind of chemical action is always going on in our body. The main thing that I'm going to highlight will be certain neurotransmitters that will act in the brain, because that's the topic we've chosen. And some of the neurotransmitters that are important to psychological illnesses are dopamine, serotonin, norepinephrine, and few others, right? So, what is a psychological illness? I mean, psychological illnesses these days is a very vaguely used term. That guy is psychologically unwell, or that guy is psychology. The term psychology itself is very vaguely used. I mean, there's no art in being a psychologist or a psychiatrist even, because everyone within their own them. Our grandmothers were psychologists in their own right because they used to pacify the grandchildren telling stories. That's part of a therapy. So, what is a psychological illness? Currently, as I earlier told about, it is a regular physical, it's like any other regular physical illness, like your asthma, your arthritis, your hypertension, your diabetes, because there's pure science and biology behind every psychological illness now, right? But still, I mean, that's what the myths that I want to clear a few myths, which say psychological illness, just give some time, you'll get over with it. Just give some time, you need to be strong, you need to get over it. What's depression? Mood off? No, you'll be fine. Mood swings? No, that's not how it works. There's a certain science behind everything. And neurotransmitters that I highlighted have a very big role in it. Yeah. These are certain myths of psychological illnesses where people think the mentally ill are violent and dangerous, which is not true. That's how it is depicted in our movies or in the TV. But that's not true. Not more than 1 to 2% are violent, and even lesser percentage is actually dangerous. They're not dangerous. They only require prompt management. That's all that is. They might be homicidal at times because they're not in their senses, because of the imbalance in the neurotransmitters. That's how it is. Studies have time and again proven that psychological illness is not to be quarantined or kept away. They can be part of the society provided they get the proper management. People with mental disorder are not smart. A study in the British Journal of Psychiatry had shown that majority of psychologically ill patients are of average to above average intelligence, some bordering even in the high IQ levels. Actually, there's a old joke which goes schizophrenia and these highly intelligent people, there's just a fine line dividing them. So they're not smart. They are actually pretty good. And mental illness results from personality weakness, nothing to do with personalities. It can affect anyone. Anyone in our room, anyone in our home, anyone, just about anyone. Mental illness is caused by bad parenting. This can be argued. It's a nature versus nurture thing. Sometimes bad parenting in a broken home can result in it, but it's not entirely parenting dependent. And schizophrenia, as everyone calls it, as split personality. That's not how it is. Schizophrenia is simply illogical thought process. They don't know the thought process is disturbed because of certain dopamine inactivity. So it's not split personality. Split personality is an entirely obsolete term. Just doesn't fit into the same category. Right. These are some of the common psychological illnesses that we see in our community. Depression, as we all know, is very prevalent in our society. It's very common. Some others include anxiety, mania, schizophrenia, and several other psychological illnesses like sleep disorders. Some people will have problems falling asleep. Some people will have problems remaining asleep. Sexual disorders, premature ejaculation, erectile dysfunction. They're all psychological. I mean, they can be biological, purely medical, but they are also psychological. And some childhood disorders, like some people will have attention deficit. I'm sure someone at some point in our lives, we've seen kids who are not really attentive, who are running around, who do not really listen. You can count it as being childish. Come on, as he grows up, he'll be fine. But 1 in 100 will probably come out as an attention deficit kid, right? So let's talk about depression now. The earlier things, sir, that you've told as it was depression, yes. And because depression currently, and according to the World Health Organization, by year 2020, depression is going to be the second leading cause of death after ischemic heart diseases. This is simply because of suicides. We read in our newspapers almost every day, wherein you see a housewife committed suicide or a lover jumped in front of the train, or you see someone putting fire to themselves. They all we all would think they some extramarital affair, they had a problem with money, financial troubles, all that. But everyone misses the underlying depression they probably were suffering. They must be having depression since a long time, and to reach to a point of suicide, it takes time. That's where we have to identify certain symptoms. Just give me some things which you would relate depression to. What would you see in a person who you would think is probably depressed? Anyone? Yeah, fair enough. Yes. Yeah, you would like to be alone. Yes, fair enough. Yes. So there are three cardinal symptoms, sir, of depression. That's depressed mood, decreased interest in pleasurable activity. That is previously pleasurable activities. He doesn't take as much fun going out to movies or playing a sport, or as much interest in hanging out with friends. He doesn't enjoy it all these days. I'm sorry. Yeah, fun. Drinking by himself would again, take it to an entirely different thing. It's an alcohol disorder. Uh, and low energy. They don't, nothing. They don't have a push to do anything at all. They wake up in the morning, the same old day, same old office, same old colleagues or old colleagues. And they don't have energy to do nothing at all. And then there's reduced concentration, attention. They keep forgetting things. Decreased libido. Probably many of us could push it under the carpet. Decreased libido is a very good sign which could actually say there is depression. Then there's disturbed sleep, diminished appetite. Those are the minor factors, but those three major factors for a period of at least more than a month, he, qualifies to be called depressed. And any thoughts of self-harm, it's pointed out somewhere, is a sign that should be, whenever he says, I think I'm bored of this life, there's nothing else to do in life, or so he calls all his kids, some elderly person calls all his kids and be happy, I would love to see the grandchildren and all you happy. It's like we have to, it could sound, be buddha ho ya, chalo, chhod do. But that's not how it is. It could actually be an underlying idea of self-harm, could actually harm himself. So spend time, talk. There's always help. If I give you a choice of spending, say, 200 rupees on single pill for a month versus suicide, wouldn't you opt for it? Yes. So please do not ignore any of these symptoms in your family or within your friend circle. Please seek help. It's all right to talk to a professional or to your friends or anyone. Just don't keep it to yourself, and please identify among your known persons. Next, we shall talk about anxiety. What is anxiety? Anxiety can be, it can present in various forms actually. Anxiety could be fear of anxiety. I mean, an exam anxiety is natural, right? We wouldn't be probably able to sleep the previous night. We wouldn't, or probably when we are asking someone out, probably when we have to go to our first interview. It's all a natural tendency. But when that becomes irrational, when there's no reason behind it, there's no explainable cause behind it, that's when it probably falls in the disorder level. Now, we differentiate between fear and anxiety. Fear, as it's shown, it's known. I mean, you see a dog, some of us could be actually scared of it. That's actually a known fear. I mean, I see a dog, I'm scared of it. It might come bite me. But anxiety comes in wherein if I walk out of the door, probably there will be a dog outside. Probably it could bite me. And you haven't even gone out, but you're already feeling the anxiety. Anxiety presents with several things like your heart starts pounding. I'm sure everyone's gone through it at some point in our life. We start sweating, hands tremor, there's some discomfort in our stomach, things like that. Only when it is irrational does it seem that would you call it a disorder. And coming back to the neurotransmitters, serotonin is a very major neurotransmitter that is reduced in any anxiety disorder. These are some of the anxiety disorders. Generalized anxiety disorder is what we had earlier talked about. Phobic disorders, phobias. People, most of us, I mean, I'm sure there's someone we all know at some point or we met at some point in our lives who's got phobia to something. Phobia is an unexplainable, irrelevant, irrational fear to a particular object or situation. We commonly see people with fear of closed spaces. There are people, would you believe, who would not, for anything, they would not get into an elevator. They would rather climb 20 floors by steps than get into an elevator. Their heart starts, they'll feel a sensation of being choked. It's a claustrophobia. I'm sure you've heard of it. And then there's agoraphobia. People don't want to go out on by their own. What if something happens to me? What if I'm lost? What if I just get a heart attack and die? They don't want to go to a big exhibition all by themselves because they're not sure they'll come back home on their own. It's a problem actually. It's a medical problem. There's again a neurotransmitter related to that problem. And then panic disorder. Panic is an acute attack of anxiety. You get panicky. I mean, we use it in our everyday terms, right? Panic. That guy's just a panicky guy. He can't handle this thing. Uh, I'm sure some of us at least have gone to a doctor and get the entire battery of tests done just because my left shoulder pain yesterday. It could probably a heart attack or it could probably a heart, something wrong with my heart. He actually slept on his left side the whole night and woke up and he probably had it sore. But no, he'd be panicked. No, I have to see a doctor. I have to see a cardiologist. I have to get this test done. That's panic. That's panic. And after a year or so, it's very tough actually. There are certain psychological therapies which we can manage panic with, but please identify and please seek help. There's nothing to brush under the carpet here. And then there's post-traumatic stress disorder. Post-traumatic stress disorder is something that occurs. I mean, stress results as after facing any traumatic life events. Like we sadly had two blasts in Hyderabad recently. The survivors or the family members or those who were present right there but were lucky enough to escape death, they probably could face something called post-traumatic stress disorder. They kind of relive the moment. They avoid, I mean, some people may even not go to Dilshuk Nagar the rest of their lives. They don't even want to put the news channels on. They don't even want anyone to talk about it. The next time they see a cycle which has anything suspicious tied to it, they would start dreading about it. Lives can become this. There was this old concept during the Gulf War called Gulf War syndrome, and there were several thousands of people who had actually suffered something from a post-traumatic stress disorder. It can really make life miserable. So that's post-traumatic stress disorder. And then there's obsessive compulsive disorder. Let me just ask you, how many of you count the number of steps you climb sometimes in a day? Did anyone do that? Yeah, yes. Here a yes. Yes. So, oh, two more. So that's, see, it's pretty prevalent. So you see it. I wouldn't say that's obsessive compulsive disorder, but I'm sure. I mean, you've seen some people. Most of, I mean, my mom, most of, women in the house, they tend to keep cleaning, right? After washing all the vessels or cleaning the room, they just want it again. They want to make sure it's clean, everything's in order. Constantly. It's a compulsive act. They're not doing it on purpose. It's just. I'm sorry. Did you raise your hand too, sir? So, yeah. So, obsessive compulsive disorders are an intrusive, recurrent intrusive thoughts or images that keeps occurring in their mind. And the need to, I mean, the most common things are checking. People put the door locked, they go home. Have I locked it or not? They come. Some people are so severe, they actually go all the way. I mean, Hyderabad to say Vijayawada and come back and see if they're. It's a fact. They've. Yes, sir. And you. Yeah, it's a common tendency. Well, it's nothing wrong in double checking, but once you do it like 10, 15 times, now that's where the problem lies. So that's obsessive compulsive disorder. Frequent washers. You see some people after touching anything, they just can't do without going and wetting their hands again and rubbing with this. Some severe cases actually can peel their skin off by constant washing. That's severe cases. So. Well, that must be in the hope they might find a new note every time. But yes, that's a possibility. So please, I mean, anyone uh, constantly running, constantly putting the same thing again and again back there, constantly washing, constantly checking to the point of actually they know that they are being indifferent, they are being irrational, they are being not right, but they just can't stop it. That's how the thought process is. Serotonin again comes back to play here. Norepinephrine comes to play here. There are medicines which can balance these neurotransmitters and make them feel a lot better. Life can become much better for them and for the entire family, right? Then there's mania. Mania is part of the bipolarity, wherein there are features of depression in the opposite side, right? Wherein depression will have low mood, this manic patient would have elated, he'll be inflated self-esteem. I'm the Lord, like he'd be. It's not like we would sometimes come across people who are highly, I mean, inappropriately dressed for the situation. You would see someone fully, made up, all makeup, everything, and come to probably a temple, which is not really, they don't gel. Inappropriate, but probably they are a bit hypomanic or manic. There are all these features. There's a decreased need for sleep. There is an increased libido here. They make advances at other women as well. What we would think is this guy is just sexually starved or something, which is not exactly the point here. He's probably having a problem. And they are reckless, sexual indiscretions, spending sprees. They keep giving donations. They think they are these millionaires and they'll just help the society. Sorry? Yeah, of course, unless he doesn't steal it from someone. Then schizophrenia. So schizophrenia is the most. It's how prevalent schizophrenia is. You'll be surprised to know it's 1 in 100. So it's not a lot, right? 1 in 100, 1%, one in every 100 suffers from schizophrenia of some degree in the world. That's the world prevalence rates. That's a lot, sir. That's a lot. And India, sadly, has very low, psychiatric doctors, psychiatric facilities, or general mental health professionals. They are so low in number that we miss so many of schizophrenic patients who, I mean, some of them you see on the roads, they probably weren't born on the roads. They were probably brought to the roads, left there. We see so many, haven't we? We all have. Schizophrenia is a chronic and severe brain disorder, and mind you, it's got management. It's got medicines which can cure it entirely. Not like he would become just like any of us, but he can be managed to the point of managing himself. He can be socially functional. He can lead a family. He can have his own, wife, children, everything. But the medicines need to be taken. Prompt diagnosis and management is the key here, right? And again, WHO, World Health Organization, identified schizophrenia as one of the 10 most debilitating diseases. And the common features that you see are, they kind of talk to themselves, kind of hearing voices. The things that they show in movies are probably sometimes exaggerated, but please identify anyone and anyone, within your knowledge. Schizophrenia, I missed the point here, is dopamine that we had earlier talked about, neurotransmitters. Dopamine plays a major role in schizophrenia. Dopamine levels are really at the higher side, they really shoot up, and that's when psychotic symptoms come up. There's a certain group of drugs which we call antipsychotics, which act on this particular dopamine, make the levels of, neurotransmitter a bit, balanced, and there you go. You have a normal patient. You have it, everything set. I would like to talk a bit about the management of. I'm actually done with the core, main psychological illnesses in the community that I wanted to discuss. Let me just put a few things regarding how lifestyle changes can bring some degree of improvement in any one of us, not necessarily suffering from those disorders. What lifestyle changes would you think can be helpful in anyone who's got any psychological problem? Perfect. Yes. Yes. Yes, sir. That's true. Yes. That's a very, very good point. Tough though, but good point. Yes. Very good. Yeah. Pastimes, hobbies. Yes. Anything which would, keep you active rather than just sit. Perfect, sir. Nothing better than that. Nothing better than that. So the basic, simple things which, many of you are so busy during the day, you probably cannot allot the time you wanted to some of your previous pastimes which you were probably doing in your college time when you were, younger. So the basic things that you can actually follow could be a morning walk. That's the ideal thing that would, anyway, any doctor suggests you that just because most of us will eventually have hypertension or diabetes. And exercise, morning walk is the best thing. I would say morning walk much better than evening walk, because the morning walk has a component, has a neurochemical called melatonin, which will stabilize your moods, which will make you feel much better, which will make you feel relaxed. So a 30 to 45-minute brisk walk in the morning, in the early morning sun, is something that would be very advantageous and very helpful for every one of us. So please, from tomorrow, just go walk. And other things would be, sometimes some of us could be, probably coffee addicts. So coffee can, worsen these anxiety features. Caffeine can be addictive. Caffeine can stimulate certain, sympathetic things, and it could result in your autonomic arousal. So cut down on the coffee a bit. Switch to probably tea. The greener tea, the better. And weight reduction and all, we just follow suit. Yoga, one of the sirs here told yoga. So pranayama, I'm sure some of you are aware of it. Pranayama is something which is very helpful. And then there's anulom vilom. There's a regular breathing exercise. That would make you feel very rejuvenated every day. Practice it for, like, I don't know, 20 minutes in the morning, let's say 10 minutes in the evening, half an hour per day, perfect. And then we'll come to counseling. Most of these disorders, except mania and schizophrenia, of course, can be talked about when they are in a milder form, can be just spoken about and get rid of. So kindly seek help, kindly seek professional help. Do not ignore these features, do not brush them under the carpet, do not follow the same myth that we've talked about. You just have to be strong and get over with it. I just gave you an option, 200 rupees a month, a tablet versus suicide. Kindly, anyone you know, kindly identify and seek help. There is help, there is proper biological basis, there is proper biological treatment to it, right? And then comes pharmacotherapy, which would balance the neurotransmitters that we're talking about. So I would like to conclude saying psychological illness is an issue that may affect anyone, just about anyone. There could be a minute degree of genetic linkage to it, but it can affect any one of us. And it has a strong biological basis and it is treatable. To round it off, Carl Gustav Jung had once said about how he asked, show me a sane person and he'll cure him. According to him, none of us are. So that's it. I end my talk here, sir. Thank you.